Good afternoon, everyone. Welcome. My name is Eleni Anslas, and I'm from Suburban Hospitals Community Health and Wellness Department. We're here to discuss how falling isn't hip for anyone, tips on preventing falls with our trauma team. Two of our members of the trauma team. We have today with us Virginia Schad, Department Director of Trauma, and Voula McDonough, who is a lead trauma nurse here at the hospital. And today they're going to talk about how we can prevent falls in our homes and other places. Every year, about 3 million older people are treated in the emergency department for fall injuries, which can lead to hospitalization and hip fractures. And we would really appreciate not seeing everyone in the hospital for falls. Just before we get started, I wanted to just give a few housekeeping items. First of all, today's presentation is being recorded and we'll make it available in the next coming days. Secondly, if you do have a question for Virginia and Voula, please use the Q&A box at the bottom of the screen, and you can put your question in there and we will, they will be able to answer your questions. And finally, after the end of this presentation, I will send out a link for an evaluation. Please take the time to complete the evaluation. We like to hear feedback, the good, the bad, suggested topics for the future, how we can improve the presentation or the webinar, whatever it may be. But thank you again for joining us, and I will let Virginia and Voula take the mic. So thank you, ladies, for being here as well.
Well, thank you and welcome for everyone to join this conversation we're going to have today on falling and ways we can hopefully prevent your falls and keep everyone safe. One second. There we go. Just for lecture perspective, I have no disclosures. So falling isn't hip anymore. Some of the things that the lecture is going to talk about is we're going to talk about risk factors that put you at risk for falling. We're going to look at things that we can do called safety checks. We're going to make some smart decisions, recognizing your limitations, and tips on how we can help you prevent falls and kind of staying independent. Just some fall statistics, and these are old. These are from 2018, so you can imagine how these numbers have grown a little bit in today's world. $29 billion is paid by Medicare yearly for fall injuries. We have another $12 billion that is paid by private or out-of-pocket costs. $9 billion is paid by Medicare for the big number of $50 billion. I don't know about you all, but I could do a lot more with $50 billion. So let's see if we can help get that number down. Facts about falls. Older adults usually fall by tripping is the mechanism that typically causes the fall. Falls are the most common type of injury that is seen in the emergency room for older adults. Falls cause more open wounds, fractures, and brain injuries than any other injury or cause. And falls are the leading cause of injury for related deaths in people over the age of 65. So when we talk about 65-year-olds, 1 out of 4 of you, 65 and older, will fall this year. 25% of those falls are hospital admissions. 40% of those hospital admissions have to be transferred to some kind of extended care, nursing home admissions. And falls are the #1 cause of fractures or broken bones. And out of that category of broken bones, hip fractures are the #1 injury that we are seeing here in the emergency department. Hip fractures have become such a concern for us in the trauma world that about 3-4 years ago, we actually started tracking fall hip fractures in the trauma world when we look at injuries, and now have included them in our injury population. So we definitely want to help you prevent falling. Why is this important? Falls affect so much of who we are and our daily lives. From a physical perspective, obviously falling doesn't necessarily mean you're going to break a bone, but you can have bruising, you can hit your head, which can cause bleeding in the brain. Sometimes falls can cause burns from if you're laying on the skin too long, or if you're cooking and something happens that way. Laying on the ground for long periods of time can cause dehydration. Dehydration can be a reason for falling, pneumonia, and then obviously death, something we all want to avoid. From an immobility perspective, it reduces our activity. We get loss of muscle and muscle tone, and it causes stiffer joints. Mentally, when you're not able to do what you physically or you do on a daily basis, it can cause depression, loss of confidence once you have fallen, and we see this a lot in the emergency department. Fear of falling again, and it restricts your lifestyle. From a social perspective, if you aren't unable to meet your friends, and your inability to leave your home, it can, again, affect your mental status. Sometimes long-term care is the outcome of a fall, and your inability to travel or move around and do those things you love to do is one of those things that falling can affect. So it's important that we keep you healthy and fall free if we can. Some causes that contribute to falls, there's many. Okay, some of them we have the ability to change, and others we don't. So mental health, weakness and frailty, our vision defects, musculoskeletal, neurological problems, heart problems, environmental, and medications. And we're going to go over each one of these and kind of break it down. So from a mental health perspective, patients who have Alzheimer's, dementia, organic brain dysfunction, patients who are confused, may not remember safety awareness things that a caregiver or a spouse or a partner has told them. So they forget, and we see this again a lot in the hospital when we tell patients, please put your call light on, or please call us before you get up. They forget that you've been told that, and that's where we typically will see falls. People who are paranoia or have psychosis obviously may not understand the concept of falling. And again, medication side effects, and we're going to see this a lot. So we want to be aware of the medications we take and the side effects that those medications can potentially have, okay? From a weakness and frailty perspective, there's many contributing factors. Your overall health is always important. Staying well hydrated, and then tying that all together, nutrition can help with the weakness and frailty. When we talk about vision defects, this is the age at 65 or older where we start seeing decreased vision, so cataracts, reduced visual fields, microdegeneration, although there's several other diagnoses. So if you have the opportunity to get your cataract fixed, obviously that will help you see better. Musculoskeletal, well, people who have arthritis or stiff joints or weak muscles. We hear this a lot, my knees gave way and that's why I fell. And when you're immobile, you decondition yourself to actually moving around. So that's why musculoskeletal histories can also cause problems. From a neurological perspective, patients who have diagnoses as epilepsy, which is a seizure disorder, who have had strokes, who have Parkinson's disease, all these things can reduce your position. So your brain's ability to tell you where your body actually is, where that left foot actually is versus where that right foot actually is. It reduces your balance ability. It can slow your reactions down. And then again, unfortunately, all the medications that we use to treat stroke and Parkinson's and epilepsy can cause decreased mentation, cause you to feel drowsy, which again, then puts you at risk for falling. From a heart problem perspective, we call these the drop attacks. Patients take their blood pressure medications. Sometimes we usually see these in the morning. They go to stand up and they get a little dizzy and they faint and hit the ground. Patients who have arrhythmias, or that would be rhythm disorders, can also fall. Changes in your blood pressure can occur when changing positions, and we're going to talk about that a little later on how to do that safely. And again, a lot of the side effects to medications that we take for heart problems can cause all the above things, which again would cause you to faint and fall. From an environment perspective, we know a lot more, and there's a lot more companies out there that can help you increase your environmental awareness. Poor lighting, rugs that are not taped or secured, stairs, that are not conducive to up and down with walkers or canes, floors, steps, and walking frames. And when we talk about walking frames, it's actually where you should be when using assisted devices and your body versus the device is. A lot of times we see what we call the overreach. People overreach and try to grab onto something which changes their walking frame and causes them to be off balance and fall. And again, we'll kind of go over that a little bit later. Medications obviously is a big contributor to falls. That's why we have a lot of assistance from our colleagues in the pharmaceutical companies. Anticonvulsants, which are anti-seizure medications, antidepressants, antipsychotics, benzodiazepines, opioids, which are your pain medications, and sedatives and hypnotics, all can cause a decreased mentation and increase your fall risk. So all these things together can contribute to why people fall. I can remember about 15 years ago, the pharmacy was involved in actually looking at patients' medication list if you came in with a complaint of falling. And we then turned that into any patient who fell in the hospital. Pharmacy was part of the team that looked at as to why that patient fell. And looking at people's medications was one of those things we really identified as, you know, a lot of times were the cause of people falling. So how do we reduce the risk of falling? So there's some things that you can do, okay? The first is having your vision and hearing checked on a regular basis, okay? Know the side effects of your medication. And some of those side effects, unfortunately, the medication's more important than the side effects, so we have to learn to manage those side effects. You want to limit the amount of alcohol you drink. My father has passed, but when my father was alive, that was one of the things that we used to kind of joke about, that, you know, Dad, you can have an occasional drink after dinner, but more than one with the medications you're on is going to put you at risk for fall. Your shoes and the type of shoes you choose have a huge impact on your ability to stay upright and safe. You want to use shoes that are rubber soled. You want low heel shoes. And ladies out there today, they have some very cute low heeled shoes, so we can still be stylish and be safe. You want shoes that fit properly and support your feet. We recently had a patient who came into the emergency room who was wearing closed shoes that she slid into, but wore her socks with those shoes that were not meant to have socks worn. And the sock slipped within the shoe, which caused her to fall. And she had a very severe fracture of her ankle in 3 different positions, and, you know, had to go through surgery and rehab. And so we're talking, you know, one choice that morning of what shoe to wear caused her 6 weeks of an unplanned injury. Try not wearing loose fitting slippers that can cause you to trip. Be careful on wet or icy sidewalks. I tell my mom all the time, don't go out, Mom, it's icy out there. And try to exercise and regularly and stay flexible. Okay, you want to keep your bones strong. Okay, and there's all sorts of levels of exercise that we can do, even for those patients who are wheelchair bound. Okay, there's still a lot of things that you can do to keep yourself healthy. Preventing falls at home. So some of this has been, you can find a lot of information about preventing falls at home. There's actual companies that you can call in. But basically, this is stuff that you and your family can do. So you're going to want to remove those small rugs that you have in your major walkways. Or if you prefer to have the rugs, you want to use some double-side tape and tape those down so that you don't have any edges that you could potentially trip over. You want to keep clutter to a minimum, especially in your walkways, okay? You want to keep your temperature in your home comfortable. Believe it or not, feeling too hot or too cold can actually put you at risk for falling, okay? Keeping items that you often use within reach. So your TV controls, I remember kind of setting up something right next to my dad's lounge chair, which he could put his TV control, he could put his little bell, which is how he got a hold of my mom. Everything was right there, so he didn't have to reach or overextend himself and potentially fall out of his chair. Install handlebars next to toilets, bathrooms, showers. Handlebars are great going upstairs, going downstairs, especially since most of these older homes have only a railing on one side. And the other thing that we kind of found out is railings kind of end right at the top of that step where you need just a little bit more help. So putting another handlebar at the top of that step actually gives you just that extra hold on that you can get up and over that step. Using non-slip mats in the bathroom or stickers in showers, that's the key. Improving the lighting in your home. As we all know, older homes tend not to have a lot of overhead lighting. And lighting, what we call low level vision, actually prefers lighting to be at a lower level. So at your knee level, if you were to put little lights along the wall that go from your kitchen to your bedroom, from the bedroom to the bathroom, you can actually see better. Removing electrical cords from walking areas, making sure they're tied down so your walker can't get stuck in it or trip in it. And install handrails and lights on all the staircases. We kind of talked about that. That really kind of will help. There's some balance disorders that if you are diagnosed with them, obviously we can't get rid of the balance disorders, but we can help you go through those. The first one's called vertigo. Vertigo is when the room is spinning. Now, sometimes people get vertigo once or twice a year. This can be a viral thing, and it's usually treated with an anti-vertigo medication. Meclizine or Anavert is usually the drug of choice. Vertigo can last 2 to 3 days. Sometimes it lasts a little longer. And keep in mind, your balance center sits right in the ear. So the next one, this benign paroxysmal positional vertigo, is a vertigo that comes and goes. Typically when you move your head side to side, roll over in the bed, or when you look up. If that is something you've been diagnosed with, hopefully you've been sent to your nose and throat specialist who can look at that. There are positional physical therapy things that can be done to help you with those. Sometimes they're caused by a buildup of crystals in the ear. And there are something called an epilepsy remover, which you can actually get done to help you get rid of those crystals. Labyrinthitis is an infection of the inner ear that can cause dizziness. So obviously we need to get that diagnosed and get you on the right antibiotics to clear that up. And then there's something also called Meniere's disease, which is vertigo with hearing loss that again comes and goes. So those are some of the balance disorders we have. Preventing falls in older adults. So the CDC, when I looked up what's going on outside the United States, World Health and the CDC have very similar programs. The CDC's program is called STEADI. STEADI is a program which STEADI stands for Stopping Elderly Accidents, Deaths, and Injuries. So this is not, falling is something that is current throughout the world, and it's something that healthcare in general has recognized as something we need to help. So it's a pretty easy program. It deals with a fall risk screening. And depending on what side you screened on, there's an assessment and then there's interventions. So we'll just quickly kind of go through that. So the fall risk screening asks 3 questions. And these are questions every one of you should be asking yourselves. Do I feel unsteady when standing or walking? Okay. Do I worry about falling? Or have I fallen in the past year? Now, one of the questions that we ask all our patients, regardless of age, is have you fallen in the last 6 months? If you say yes to that question, regardless of why you're in the emergency room, you are an automatic fall risk for us. And those are things that we need to be aware of so that we can keep you safe while you're here. If you answer no to those questions, then you're not at risk. So things that you can do to continue to keep yourself on the not at risk list would be to educate yourself on fall prevention. And you can Google this, there's books on it, there's webinars. Everybody's on board about fall prevention. Vitamin D is actually been shown to help continue to strengthen bones and keep you strong. Exercise and fall prevention programs, and then having this yearly assessed. If obviously you have a fall when you're in the not at risk category, you need to ask those questions again and look at changing things. If you answered yes to any of those questions, you are at the at-risk group. So what are the things we can do? You need to have your gait evaluated. And by gait, we mean how you walk, okay? And, excuse me, and the strength and your balance. So all those things need to be looked at by a professional. And this is something where a cane can help you, or would you be better suited with a walker? We need to look at your medication list, and we need to identify those those medications that can increase your fall risk. Sometimes we can change those medications, decrease the dosages, but sometimes we can't. So we have to look at, is it better for the patient if they take this medication at night? I'm on a blood pressure medication that tells me it can cause drowsiness. And I'm thinking, great, I take it in the morning and get it in my car. Is that really smart? So those are kind of things that you can ask questions and have discussions with your physician about. Evaluating your home hazards. Again, climbing up and down stairs keeps you active, but you also want to keep yourself safe. So looking at lighting those stairs, where is the bathroom path in relation to your bed? Are carpets tagged down? Is there enough lighting? Orthostatic blood pressure, that's a word that basically means taking your blood pressure in 3 different positions. And we do this frequently in the emergency department. You do your blood pressure and pulse laying perfectly flat. Then the second position is sitting you up with your feet actually off the stretcher dangling, okay, as if you were sitting in a chair. And then the third one is actually standing you up. And what we look for is changes in your blood pressure and changes in your heart rate. If your blood pressure goes down with the change in position, it tells us one of 2 things. It can tell us you're dehydrated, okay? And you probably need some IV fluids. And that may be the reason for your fall. Sometimes heart rate doesn't react and by react, I mean, it doesn't elevate when we change position in the elderly because they're on drugs that actually stop that. Your calcium channel blockers and your beta blockers will stop you from having an elevated heart rate. So at that point, we have to make a decision, and that's, those conversations we have. Vision, okay? Your vision also affects. I know for when my mom got her new bifocals, when she looked down to go down the stairs, she's like, oh my goodness, I'm dizzy. And I can remember saying to her, Mom, why don't you take your glasses off when you go down the stairs so that until you get used to them. So, being smart about those tools that we use to see better sometimes can cause dizziness. Assessing your feet and footwear. Again, I came to a point in my life where the 3 and 4 inch heels just didn't work anymore. And so I had to get rid of them so that I wouldn't be tempted to use them. But make sure you have a good shoe on that can keep you safe. And then again, the assessing of the vitamin D is very important because it keeps you bone strong, okay? What are some of the interventions we can do? So if you are diagnosed with a poor gait or strength or balance, in other words, what do you look like when you're walking? The doctor can prescribe physical therapy, exercises, or you can do something like Tai Chi if you need to increase your strength and balance. Tai Chi is actually very good for 65 and older. It's very slow moving. It actually over time builds your core and your balance. Medication increasing risks of falling. We can speak to our physicians about stopping medication, possibly switching it, reducing the dosage, or changing the way we take it can also help. The orthostatic hypotension, again, checking the medication. If you're in the ER, and depending on why you're here, we probably will give you some hydration. Foot pumping when you change positions. So 6 o'clock in the morning, I'm now getting up. So I've been laying flat all night. So I'm going to sit on the edge of the bed, just like we said that second position was. You're going to sit there as if you're sitting in a chair. And you're going to sit there. And when I say for a couple minutes, I mean 2 to 5 minutes. You're going to pump your feet and get those veins pumping that blood back up into your system. Okay. So that when you do stand, you're not going to faint on us. Keeping well hydrated is another challenge for our elderly population because a lot of medications that you're on make you go to the bathroom. So a lot of patients don't want to drink. My suggestion for that, and I tell this to my patients all the time, start early. Have one container that tells you how much water you have to drink. And if you start early and finish about 2 hours before you typically go to bed, you should not have to hopefully get up in the middle of the night to go to the bathroom. Consider compression stockings. And some of the drawbacks of compression stockings is that they're difficult to put on, and I agree they are. So there are prescription strength compression stockings that typically are in the 30 milligram per mercury strength, and those are pretty difficult to get on. The compression stockings, I think, that are being spoken here are things that you can buy on Amazon or at a drugstore. They're about 15 millimeters. They're still tight, but they're easier to get on. And they will help keep that venous return coming. And that's important because that's what keeps your blood pressure going. When we talk about visual impairment, making sure you get regular eye exams. If you do have cataracts, hopefully you can get those corrected, cataract surgery. Depth perception is something that we see a lot with low vision patients. And when we talk about there's a whole thought process out there on depth perception. Single versus multifocal lenses. Depth perception is when you look down, there is no difference that you can see, and especially at night. So putting those lights that we talked about at that knee level can actually allow you to see the difference between the floor and the carpet and the step. So those kind of help. Feet and footwear issues. Well, obviously we talked about this a lot, and I do love shoes. So good shoes that fit, that have good rubber soles and traction, okay? And you want to keep your heel height less than an inch or two. Bigger, fatter heels will do better than the pointy, smaller heels. Vitamin D deficiency. You want to consider taking vitamin D. Have a conversation with your physician. This is something you don't need a prescription for. You can get this over the counter, and it will make a difference in your bone strength. Comorbidities. Comorbidities are those things that your health that you inherit. And some of those things we can fix and others we can't. So you want to optimize the treatment of your known medical problems. You want to be mindful when you talk about drugs that can contribute to fall risk, okay? And a lot of drugs today, I think a lot of people, we've gotten smarter as a community and taking care. And actually there's a lot of warnings on those drugs. So pay attention to those, okay? When we talk about exercise, it again doesn't need to be something as formal as Tai Chi. Swimming, I know there's a lot of swimming classes out there for the elderly, which are great for improving mobility and strength. And something as easy as chair rise exercises, which, as you can see in the picture, is just kind of building the strength to sit up and down on the chair. Smart decisions when it comes to your health. You want to follow your doctor's advice. You want to take those medications as prescribed, okay? We don't want to miss any doses. We don't want to take too many. You want to change positions slowly, whether you're sitting in a chair and are going to stand, whether it's a nap and you're getting up, make sure you go from lying to sitting to standing, okay? Lying to standing is not a good idea, even in someone my age, okay? Your body needs some time to adjust to the blood pressure. You want to use ambulation tools. And I know that there's a lot of negative thoughts out there with ambulation tools. We've heard it from patients. We've heard it from family members who are tattling on their patients that, they don't like to use their walkers or wheelchairs or canes. My comment to that person is, well, you can use your walker and keep yourself safe, or you can come see me again when you fall and break your hip. You want to make sure that your vision is checked yearly and that you stay well hydrated. Smart decisions as far as your environment. Now, some of these things can be changed easily, others cannot. So do what you can. We want to make your home safe. You want to make your inside and outside safe. So cracks in your cement should hopefully be filled, because that's something that you can trip over. Keeping the clutter off your stairs or steps, okay? Fix the loose or uneven stairs. Ensure good lighting. Secure handrails, okay? Things that are secure, that when you pull on it, it doesn't shake. Secure those carpets down or get rid of them altogether. You want to clear that path, and that's what, moving, look about, see how your day is. If you go from your bedroom and you come down the stairs and you walk into the kitchen, is that path clear? Okay. You want to move your furniture so you don't have to walk around something. You want to make sure that path is well lit. Okay. You can remove rugs, you can use a double-sided tape, whatever makes you happy. All those cords, again, we want to make sure those are coiled up and tied, okay, off and near the wall. In the kitchen, I talk to patients about keeping things on lower shelves so you can reach them. If you do have to use, I had a patient once, she was 4 feet and she's like, really? I can't even reach the lower shelf. And she says, I have to use a step stool. I said, okay, well, if you have to use a step stool, then please use one that has a bar and only has 2 steps. You don't want anything higher than that in the kitchen. Okay, we call those ladders. We don't want to be using ladders. Something that you can hold on to. And if you position the step stool so that you can next to the counter, so that you can also use the counter as support, that hopefully will help you from falling. You want to keep your floors clutter free. A lot of patients have pets, and we hear this a lot, that they trip over their pets. Now, I don't know what we can do about that, but if we try to keep the pet's water bowl and their food bowl out of your path of walking, hopefully that can decrease the amount of times that you fall because of your pets. Again, it's that good pair of shoes. We've talked to that. In the bedrooms and bathrooms, again, good lighting near your bed where you can reach it. We talked about years ago, I remember as a kid, the clap on, clap off. I think those are wonderful for someone who needs lights on instead of trying to get out of bed and reaching for the light. The clap on, clap off, immediately, you don't have to do much, just clap your hands and the lights are on. You want to, again, clear that path from your bedroom to your bathroom. You want to use those night lights to see your path. And you can get low level night lights so they're not bothering you and causing you not to be able to sleep. You want to put non-slip rubber mats or little stickers on the bathtubs. You want to put handles in. Prior to my father's passing, I remember redoing their bathroom, and we brought in a company that specializes in making bathrooms that lower the level of the shower, putting handrails where in and out of the shower so that they can grip, and he had places to grip and he could be safe going in and out of the shower. Installing the handrails like we just talked about in the entrance and exit of the shower so that you have places to go, and make sure that you have rugs on the floor of the bathroom so that you're not slipping on potential water that was spilled. Staying independent. How can we stay independent? You want to speak openly to your healthcare provider and family, and you want to engage your family with doing these assessments and moving the furniture around and getting rid of, replacing things, getting those lights, getting those handrails. We want to keep moving, taking walks, exercising, both helps balance and strength. Get your annual eye exams and try to make your home safer. And all of this is done so that we can keep you safe and free of falls and keep you out of my workplace. And that is my lecture for today. And I'm gonna have Virginia come in. It looks like we have.
Thank you, Voula. So the first question, so if anyone has questions, please put it in the Q&A box. I also included, Montgomery County has a resource that Voula mentioned to me earlier, and I think it's a little outdated. I saw a number that doesn't apply to Suburban Hospital anymore, but it's still good information to have. So take a look at that in the chat box.
Yeah, I also forgot to mention, Montgomery County has its aging and disability services, and they have, I'm looking at their little pamphlet that I know you can't see it, that I pulled out, but talks about exercise opportunities, health education, screening and assessments for falls, talking to a pharmacist about your medications, and then home safety checks. And there's companies that will come out and do that for you. So that's right on the Montgomery County website. And all I did was Google Falls Montgomery County, and this is what came up. So it's very easy.
Yeah, and I included that in the chat box. So thank you. So the first question is, will the slides be available? Do you mind sharing the slides?
Oh, no, not at all.
Okay, great. That's an easy question. Yeah. There are so many options for grab bars in the shower and near the toilet. Do you have any recommendations?
So again, you have to really kind of look at your area. So when we were kind of talking with my father, what we did is in the shower, they actually installed grab bars that are installable, like they were screwed into the because we had the opportunity because we were making the bathroom over. But outside, because the way the wall was, it was better to get the ones with the suction cup, okay? And make sure that you get help and make sure those are applied. And I check them. I typically, would tell my mom, make sure that it still suctions and stuff. But you're right, there's so many different options, and it also depends on if you have arthritis, there's fatter bars that you can grab that may be a little difficult for you. So you want to get out there and you want to actually feel them. And make sure that there's ones that you would go. Their ones are about 2 inches. So they're for bigger grips. There's ones that are smaller. But if something's too big of a grip for you, think about that. If you can't get a good grip on that, that can also make you fall. Okay. I hope that answers your question.
So I've seen the ones with the ones that are drilled in, and then also the suction cut ones. Yeah. So I guess both of them do the same thing. If a person has peripheral neuropathy, can it increase? If one has a peripheral neuropathy, can it increase fall risk, and what can be done about it?
So peripheral neuropathy can be caused by many different reasons. There are medications out there that can help manage your peripheral neuropathy, because peripheral neuropathy can be painful, but the other part of it, the neuropathy part of it, means that you have decreased sensation. So yes, this definitely can increase your fall risk. And when we talk about doing a fall risk assessment, someone who has a history or a diagnosis of peripheral neuropathy, it puts them at greater risk. So things that you can do, you definitely don't want to walk around barefooted. If you have lower leg peripheral neuropathy, you want to put your shoes on, because believe it or not, your shoes will give you a little bit more of that. We talked about it with my stroke slide, the brain's knowing where your feet are. Okay. Even though you don't have as good sensation, putting shoes on actually helps that. Wearing the stockings can help with circulation, which can also decrease your peripheral neuropathy. And again, kind of just looking at your environment. If you know you're at increased fall risk because you can't feel where your feet are, then you definitely want to have well lighting so you can see where you are, and make sure you have a good path, a walking path. Okay. Those are my recommendations for you.
Thank you. What is the recommended vitamin D dose for seniors?
I'm definitely not a senior expert as far as vitamin D. I want to say what we typically see is things like Caltrate 600. Some of them have vitamin D, some of them have calcium as well. The two of them work well together. I want to say 500 to a gram, but again, definitely this is something you can chat with your docs about. And then those people who have had gastric bypass surgeries actually require more vitamin D. So again, a conversation you want to have with your pharmacist or a physician.
Perfect. You touched on this briefly, but someone's asking what the best exercise to do to lower the risk.
So strength exercising, and I don't mean to go out there and, push 100-pound bell bar. So even if you get the 2-pound bars, the 2-pound dumbbells, thank you. Hand exercises, okay? That helps increase your strength, because remember, you have to have strength to pull yourself out of a chair. And then your lower body. So those chair exercises that I told you about, where you can stand up and sit down and stand up and sit down, that's strengthening your legs. Water exercises can do this. And I see them in the gym sometimes when I look through, and I can see our elderly population in the pool. I think it's awesome. You can also speak to a physical therapy expert who can give you a list of things that would work for you. Again, everybody's a little different, what you can do and what what medications you're on. But start slow and talk to your doctor about what kind of exercises or an exercise program that they can put together. A lot of these senior exercise programs have been put together for exactly that. Yoga is good too. For those of you who can get on the ground and do yoga, I have a hard time getting back up once I'm on the ground, believe it or not. But something that's done twice or 3 times a week, slowly over time. And again, I tell people, it's not a magic pill. You're not going to be better the next day, but over time, it does help you strengthen and hopefully keep you safe.
Perfect. Thank you. I didn't know if there were any other questions. If there are, please feel free to put them in the Q&A box. Virginia, did you want to say a few things?
I did. Hi, I'm Virginia. First, I want to thank Voula so much for doing this. As our trauma service is invested in injury prevention as well. And just for some perspective of the almost 2,000 trauma patients we see each year here at Suburban, about 60% of them are here because of falls, and about 60% of them are over the age of 58. So we have a real opportunity here from a public health and injury prevention standpoint. That's part of the reason why we're so passionate about this. So I just want to thank Voula so much for her expertise and what she contributes to our program and to our injury prevention. So thank you, Voula. And thanks to Lenny for setting everything up. It's been great.
Oh, my pleasure. So I'm just going to do a shameless plug. We talked about exercise here. Suburban Hospital, we have an amazing senior shape exercise program. We have weight training, we have aerobics, we have flexible strength, stability ball. So Monday through Friday, and that can be found on our events page. I don't know, we have a question here about affordable Tai Chi programs. I don't know if you know of any affordable Tai Chi programs. We do have a Tai Chi program at the hospital, not at the hospital, but at one of the senior centers. But I'm not sure if that,
I think the county also, going through Montgomery County Recreation, they also have affordable Tai Chi programs.
Yes, certainly. Were there any other questions? And if there are, oh, there we go. Are straight leg lifts in prone position detrimental to hips that have advanced osteoporosis or to the hip joint? They are great for thigh muscles, but I worry about hip joint and hip bone fragility with leg lifts from laying position.
You are absolutely correct. So leg lifts are going to strengthen your quads, not necessarily improve your hip joint. And I know this only from the fact that the last 1.5 years I've been in an exercise program to strengthen my hip and lower back. And so again, these are specific, any trainer, any physical therapist can give you specific instructions on how to improve your hip. And actually one of the best ones is what we call, now I forget it, where you lay on your back with your knees bent and you just lift your bottom up. Butt lifts, I think, bridge, that's it, it's bridge. Your bridge exercises actually really help to lower your to strengthen your lower back and your hip muscles. But again, if you're planning on starting something like that, and you have access to, I would definitely consult with a physical therapist who can hopefully put a program together for you. Seniorplanet.org has online free exercise classes, including Tai Chi. Well, thank you, Elaine. That's a nice one to have.
That's a good one.
And Montgomery County offers a bone builders program that works on strength, arms, and balance. There you go. I knew the county had a lot to go. Thank you again, Belle. Those are awesome references for everyone.
Yeah, and I didn't know if everyone knew, but the Montgomery County Rec Department is has the free. They're opening up like a free pass. You can just use the community centers rather. Their space. If I'm sure there's also exercise rooms in there too, but that's another thing, another resource. But wonderful county resources that we have here in Montgomery County. If there aren't any other questions in the Q&A box, we'll end today's presentation, and also Prince George's County too, of course. So thank you again, Voula and Virginia, for your time. I appreciate it. I'm going to send out the link for the evaluation. So please take your time and complete it. We appreciate it. And thank you all for being here today. And we'll see you next time.
Thanks, everyone. Have a great day.
Thank you so much.
Happy New
Bye,
Year.
everyone. Happy New Year.